mesra. Yes, Harjinder and Nasra, write down the problems you are facing in writing. Yes, yes. Good evening, Binsimol. Harjinder, write your first name and second name. All of you, those who are attending the session, write first name and second name. Write your first name and second name, Harjinder Kaur. Write your, give your attendance. Yes, Harjinder Kaur, good evening. Yes. Yes. Make it up, build it up fast. 11 students, very good. All the students, write your first name and second name. Rehana, I need your second name, please. All the students, write your first name and second name. Give your attendance. This is your attendance. Yeah, welcome, Constance Mafosa. So, how many students are attending today? Nasra Ali, Binsimol Thomas, Harjinder Kaur, Constance Mafosa, Rafia Wahid, Noore Alam. Very good. Come on, give your attendance first. Rehana Asif. Okay. Have a nice day. Who is this? Have a nice day. Rehana Asif. Okay. Have a nice day. Can you type your name, please? Rehana Asif. A capital letter, SIF small letters. Yeah. Have a nice day. I don't know. I cannot call you like have a nice day. So can you please give me your first and second names? Right. First and second names. Fast. I don't have all the time in the world for you. Give your names. Give your attendance. Yeah. Yes. Fahim Mufti. F should be capital letter and M should be capital letter. Yeah, like this. Okay. Good evening, Meera. Yes, all of you give your names, first and second names. Yeah. So today we are going to have one official letter. Sally Fletcher, how to construct the letter is the name of our today's game. Sally Fletcher. Yes. Sally Fletcher. Suma Maria, good evening. Write your first name and second name, please. If afterwards I'll take them as attendance. Sally Fletcher. So we are going to do two letters today. One is nurse's letter and one is doctor's letter. Yeah, Suma Maria. Right. Tonight we are going to blast. I'm very happy today because we got the agreement done, and tomorrow onwards we are going to set our office. So I'm very happy. So we are going to sit for a long time in the night. So whoever is going to stay with me, you can stay. It's an open celebration. We are going to have a feast of our lectures. Today, all the sessions will be open. Okay. All the sessions will be open today. So whatever problems you have, you can discuss with me today. We are going to slaughter or kill or murder the night today. Yes. So, yeah, you can invite your friends. Vincy Mall, regular student, Constance Mafosa, Harjinder Kaur, Meera Manoj, Nasra Muhammad, Noor Alam, and Suma Maria. Redmi. Who is this Redmi? Redmi, please give me your first and second names, please. Because I cannot call you Redmi, right? Okay. Now what I'm doing is, here is our letter. 1 to 5 pages. Now here, we'll focus, right, on the sentence structures. Okay, write down, what do you want me to focus today? Sentence formation, what you want? Or you want organization of the letter, or you want the passive voice, or you want ideas generation? What exactly you want? You can ask me today. Okay. File, export to Microsoft Word document. Yeah. This is a Microsoft document now. Right. Right. Go through these points. We're going to discuss all these things. What all the things are required? Yes. First, second. Yeah. Your name, please. First, second, your name, please. I already requested 2 times. Okay. So, name, please. So, first, second, please give your name. Then next. Right. So, people without names will not be allowed. No voice. So what you can do is, you have a problem there. You have to you have to open your mic voice over internet. So you don't know, maybe you're new for this one. Nasira Batul. Okay. Name please. Okay. So you cannot hear me. If you open your mic on the voice over internet, then you can. Okay. Chat. Open voice over internet. Yeah. Then ready. Yeah, all of you, those who are regular, write your names. Okay. Yes. What all your problems are there? Nobody is permitted to start your video or audio without my permission. Okay. So right. So here medical card and a nursing card, both are there. Oh, this is the connection of here. Okay. Right. So, okay, Stephen, second name. Name please, second name is, okay, name please is Stephen. Stephen doesn't know how to open his mic. Okay. Somebody write in chat box to him personally how to open his mic. I have mentioned him, but still he is not able to open it. Rename Stephen. Stephen. Second. Yeah. Okay. Ready. Get along. Now here, now first, yes. Now let us see what are the letters we can use. Now here, you're a nurse or you're a first year resident and the ward is surgical ward and the name of the hospital is Fairbanks Hospital. Address is here, Fairbanks Hospital, 1001 Noble Street, Fairbanks, aka. Yeah. So this is the point. This is the story here. Okay, this is your address. Either nurse, registered nurse, surgical ward, Fairbanks Hospital, 1001 Noble Street, Fairbanks, AK. Yeah, this is how you are going to do. For the first 10 minutes, we are finishing all the other things. Then, yeah. Quality check answer sheet. Organize pages, file save as. This is Mrs. Sally Fletcher. QQ format. I'm showing you the format. How to follow the letter. Format first page and second page. Leave the first line. Nobody is going to ask you anything. So don't mess up here. It will be messy if you write here. Because here only congested it will be. So start from here. Okay. Now first thing is, okay, we are going to have 3 levels of story. Right. This is letter format. Letter format. Okay. These are the 7 components. Very fast we are going to move ahead. So the letter format, the 7 components. Okay. So whenever you are writing a letter, okay, you have to follow these 7 components, do's and don'ts. Do's and don'ts. You have to follow these do's and don'ts, 7 components. Right. So once you follow this, you will be perfect. No need to worry regarding anything else. These are the 7 components which you are going to follow by all means. Don't miss these things. This is called a checklist. We can say checklist. So if you follow this checklist, it will be easy for you. And you have no confusion. You will not go wrong anywhere. So 7 components. Right. So the 7 components. The 7 components. Number 1 is the recipient's address. Recipient. See, many times I also get confused. What is the spelling of this? Okay. So sometimes I get confused. I know the spelling. It's not that I don't know. Recipient is a formal word. Use it. Recipient is a formal word. Okay. You can use it in your speaking and writing. So recipient's address. Now where will we get this recipient's address? Number 2, the date, the salutation, the subject line, the subject of the letter. Number 5, the body of the letter. And number 6, the closing remarks or the closure, the salutation, the closure you can say. And the last one is the sender's particulars. These are the 7 components which are very, very essential. 7 components Stephen second, sir, please help me, could not hear you. I have been writing number of times. You have to open voice of net. How can I tell you? Cannot hear. How can I type there? Somebody just message him how to open the voice over internet. Is new, I suppose. So he's not able to connect his voice over internet. Somebody type him, because if I start explaining him, then I will be at a loss and everyone will be at a loss. Somebody just type, okay, in the group, how to open voice over internet. Okay, connect mic over internet so that he can listen. You all know that one. So somebody help him, please. Okay. Yeah. Please open your voice over internet. Yeah. His mic is only not on. His mic is not on. He has to connect voice over internet. Okay. Maybe his laptop, I don't know. Maybe his volume may be in laptop. Otherwise, its phone means okay. There are two. Mira Manoj has laptop. So, sorry, computer. But Stephen, I don't know what it is. So, right. These are the 7 different components that you are supposed to write. Yeah. So these are the 7 different components. Did I put stop live stream? Yeah, live streaming. Okay. So these are the 7 components that you have to follow by all means. Right. By all means. So letter format, the 7 components you're taking. So these are the ticks. What should you do and what you should not do? What you should do? Yeah, that is better, Stephen. Okay. Right. So the letter format, you have the 7 components. We're going to find them fast, both doctors and nurses. Okay. The 7 components, note them down. The 7 components. We try with a very great difficulty, but others copy it. So that's why. Yeah. Yes. So these are the 7 components. Now let us check. The first one is number 1. The recipient's address. The recipient's address. The recipient's address will be 5 different lines. Number 1, the name, the designation. Number 3, the facility, the street, the town, the country. So like this, different things will be there. The state. So 7 points are there, but we don't have all the 7 points. Mostly we'll have 5. Mostly we'll have 5. Okay. Mostly we'll have 5 different things. Yeah, iPad. So we have 7 different things here. iPad still not able to set. So right. So these are the 7 different things. For the recipient's address, you have to find these 7 different things. The name, the designation, the facility, the street, the town, the state, and the country. These are the 7 different things that you have to follow. Now let us check what are the 7 different things. How we'll find out? We'll just spend 10 to 15 minutes on this, and afterwards we'll focus almost a lot of time on how to generate. This I'm going to give you awesome practice for your sentence structures today. Right. So these are the 7 points. Yeah, 7 points. The name, the designation, the facility, the street, the town, the state, and the country. Now, if you see here in the address, you have here, so nurse or first year resident, surgical ward, Fairbanks Hospital. So these are the things. So there are two addresses. One is the doctor, how they will write, and one is nurse, how they will write. Yeah. So this is a nurse. It is a nurse. It was n small letter. And right side will take doctor, first year resident. First year resident. I'm showing you both. Only here a different, otherwise everything same. Here it is a nurse or first year resident. This is for doctors, will write like this. Nurse will write like this. This is not fine, fair enough. Okay, just hold on. Otherwise everything is the same. Okay. Next, second line, surgical ward. Second line, you write surgical ward. Afterwards, editing. First, let us check what is coming. So, copy text. Fairbanks Hospital. Okay. Yeah. So everything is same. So only this first line will be changed for doctors. It will be first year resident. F should be capital letter. Y should be capital letter. And R should be capital letter. So first year resident. Okay. First year resident. Doctors will write first year and resident instead of this one, nurse. And here it will be registered nurse. Then surgical ward. Surgical ward. Fairbanks Hospital. 1001 Noble Street. Fairbanks. AK. What does AK stand for? So you should know these things. Okay. Fairbanks is in which? Fairbanks AK. We just check. Fairbanks is in AK. AK is for Alaska. AK is for Alaska. Right? So Fairbanks is in Alaska. That's it. So here, if you know, you write it. If you do not know, just write as it is. So these are 5 things. So registered nurse, surgical ward. Here name is not given, just registered nurse is given. Surgical ward, Fairbanks Hospital, 1001 Street, and Fairbanks, Alaska. See here, the name is missing. Okay, what's the name of the nurse is missing. Otherwise, everything is there. Everything is there. So I told you. Okay, at least 5 will definitely be there. And instead of registered nurse, you can write first year resident if it is a doctor. That's all. Otherwise, everything is same. Then what you have to do is you have to leave this line. You have to leave one line here. Leave one line. So leave this one line here. Okay, don't write anything in this line, please. Leave one line. From here to here, leave one line. That's it. This is no writing zone, because this is what first component to the second component you are moving. So it is finished. Now next one, second one is the date. Okay. So now the date has three components. First one is the date, and the second one is the month, third one is the year. So these are the three different things. The date in figures, the month in words, and the year in figures. 4 digits. 4 digits. Okay. This is in 1 or 2 digits. That's not a problem. Here, the year in 4 digits. 2023. 4 digits compulsory. So remember that. Okay. Now we are going to get that one here. From where will we get that one? So we'll get that one. So the date we are writing the letter. Appointment date is 25 March. Diagnosis, social background, medical background, and post-operative care, mobility, nursing management, medical progress, assessment, discharge plan. Okay. And here, so where is the date? So date may be in the discharge plan, the discharge date. There they will give sometimes before last visit. So here nothing else is there. Appointment date is 25/3/2018. And here date of birth is 3/10/1993. Okay. So date is not mentioned here. So that's not going to be any problem, because you'll write the exam date itself. So here there is no date. So we can write today's date, because on the examination date, what is the date, that only you will write. Okay. That only you will write. So yeah, here appointment date. Yeah, that's it. So no other date is there. So you will write this date itself. Okay. So right. Now let us see. Now 25/3/2018. Okay. So here, to whom you are writing? Yeah. So to whom you are writing? So let us check here. Nurse. You're a nurse. So this nurse you will be carrying from here. At the ending, here you'll get nursing letter. Using the information given to you in the case notes, write a letter summarizing the patient's condition and communicating discharge instructions to home health nurse. Yes, home health nurse. And her name is Joanna Stevens. Joanna Stevens. So you'll be taking this address. Okay. This is the address. So now there are two addresses here. So this is the first address, and this is the second address. So this will be going to the last. So you are writing to the home health nurse. And the name is Joanna Stevens. Millhouse Visiting Nurses Association, Farnham, GU101HA. So here, so you have to make it capital letters. So this is the address. So this is the address when you're writing to a nurse. Home Health Nurse, Joanne Stevens, Millhouse Visiting Nurses Association, Farnham GU10. Now coming to this will automatically go to the last second page. These are the sender's particulars. So you are writing this a letter. Yeah. Next. So this address will be different. Okay. Right. Now, next, the date. The date is 25 March 2018. 25 March 2018. Yeah, you'll be losing your marks. There will be marks for everything. Okay. So 25 March 2018. Don't write this number for March. So 25 March 2018. So write the date. Some people will start writing from here. Some people will start writing from here. Don't start. Start from the first dot here. From the first dot onwards, you have to start. Remember. So 25 March 2018. Then again leave another line. Leave another line. Okay. Then next, here salutation. Home health nurse. So dear nurse. Dear nurse and a comma. Dear nurse and a comma. So whatever information is there, everything you have to write. So because we have 400 marks, but many people don't know that they are writing only for 400 marks instead of 500 marks. They are attempting only for, so they are attempting only for this one. But here there is a problem. Can anyone identify any problem here? So they gave in an order, in a different order. So here name should come first and the profession should come next. So this Joanne Stevens will go up. This will go up. So this is very important. When name is there, name will come first. Yeah. Now this one, Joanne Stevens. Now this Joanne Stevens is Miss or Mrs. So you have to check. Yeah. So here, nurse. You're writing to health nurse, John Stevens. So nothing is given. Nothing is given. So no way any information is given. So you just write MS. When you don't know anything, to avoid confusion, just write M and S when you don't know anything. When you know that she is Mrs. married and she is still marriage is existing, then you have to say Mrs. Right. So Miss is enough. That's a common frame. Common frame. And here, dear Miss Stevens, comma, dear Miss Stevens. Dear Miss Stevens. Finished. Leave another line. And then afterwards, what is the subject? Regarding line you have to write. Regarding Mrs. Sally Fletcher. Yeah. This one. Copy. Regarding column Mrs. Sally Fletcher. Regarding Mrs. Sally Fletcher. Regarding Miss Sally Fletcher. Regarding Miss Sally Fletcher. They should be in top to bottom, they should be in a straight line. This is called left margin. This is called left margin. Regarding Mrs. Sally Fletcher. Then, comma. Now, there are two things. One is date and age, date of birth or age. Now here, date of birth. Only date of birth is there, write date of birth. If only age is there, write age. If both the date of birth and age both are there, then write a date of birth only, because date of birth is better. Okay? Right. Date of birth is 3/10/1993. DOB colon 3. You can write like this, or you can just write 3. Enough, no problem. March, sorry, 3 October. 3 October 1993. Finished. So regarding Mrs. Sally Fletcher, many people, what they do is they'll leave space after regarding. No, you should not put, there should not be any space before colon, before comma, before full stop, no space. There should not be any space. So before comma, no space. See, some people write space before comma. That's the biggest mistake. Don't do that. It's a mistake. It's a punctuation mistake, we call it. So no space before comma, no space before full stop, no space before question mark, no space before colon and semicolon. Remember that. Yes. So leave another line here. That's finished. 4. So address Miss Joanne Stevens, Home Health Nurse, Millhouse Visiting Nurse Agent Association, 25 March 2018. Dear Miss Stevens, write the second name for people above 18. So she's a nurse. So definitely above 18. So second name should be taken. Dear Miss Stevens. Dear Miss Stevens. If no information is given, just write Miss. No information is given. Naveen Hirani. If your screen is not visible, you can exit and join again. So you can exit and join again. You have some network problem, that's it. Next is the body of the letter. Next is the body of the letter. Then afterwards, we'll go to the next page. We'll go to the next page. Next page. Okay. Okay. There. So 1, 2, 3, and 4. The body of the letter. So we are going into the body. So only 2 more parts are left. So at the end, you have here. Right. Okay. So we have seen these points now. Then the date. Then the third one is you have the salutation. Then you have the subject line. And then lastly, we have 2 more things. That is the closure. Yours sincerely or yours faithfully. Either yours sincerely or yours faithfully. So if it is any one, you can use. So number 6, the closure. So you can use both, any one. YOURS, yours, no apostrophe. Sincerely. If you know the name of the page, person whom you are writing to, you'll say yours sincerely. If you are writing to a nurse, then you'll say yours faithfully. If you are writing to Miss Stevens, you'll say yours sincerely. Here we have Miss Stevens, so that's why you are saying yours sincerely. And if you are writing to a nurse, starting with a nurse, okay? If you are starting the letter with a nurse, but here you know the name of the nurse. At the end of the letter, you know the name of the nurse. The name of the nurse is Joanne Stevens. So you will write yours sincerely. If you write your starting line with home health nurse, then it is yours faithfully. So name, you know the original name of the person, then you say Joanne. If you are starting the first line with Joanne Stevens, it is yours. Okay. And if you are starting the first line with home health nurse, then it is yours faithfully. Because the name is not given. Suppose Joanne Stevens not given and only home health nurse is given, then you will say yours faithfully. That's it. Then last, our sender's address. I already told you the sender's address. Okay. Sender's address will be here in the beginning. So nurse, first year resident, surgical ward, Fairbanks Hospital, 1001 Noble Street, Fairbanks, Arkansas. Okay. So that's done. Finished. All the other things are over. Now I want to ask you one question. So is everything Clear. Now we'll go to the body of the letter. Just let me know if everything is clear. Just to give a message. Yes or no. If everything is clear, say yes. Because we are jumping into the letter. Please, all of you. Yes, please. Be generous enough to say yes. Okay, somebody is going on paining his throat and telling something. Be generous enough to say yes so that I can move. Why should I wait for you people's yes? Okay. Right. Generosity is a virtue. Okay. Generosity is a virtue. It's not everyone's cup of tea. You are my student. I want every one of you to be generous. Yes. Shifali. Yeah. Shifali, you told yesterday, sir, writing the paragraphs are difficult. Okay. So now we are coming there. Yeah, very good. You are attending now. Shifali.
Yes, sir. Good evening, sir.
Good evening. Did you understand what I taught you till now?
Yes, sir.
I'm teaching the basics now. Okay, fine. So you can mute back. Thank you. So now coming to the point, we are going into the main body of the letter. We have 5 parts of the body. We have 5 parts of the body. So 1, 2, 3. Okay. Second over. Third one. Third one is the salutation. You know that. Salutation. Salutation. What salutation? You know. Dear. Okay. That means the title. The title. The title. Okay. So first one is so how you are addressing the greeting, dear. The greeting. Then the title, dear Miss or Mrs. The title. Then the last name. So this is salutation. Then fourth one. Fourth one is the subject. The subject is yeah. You will use the phrase regarding colon. Okay. And then you will introduce the patient. And you will introduce the age or the date of birth or the age. First you have to give the date of birth. If date of birth is not there, then only age. Both are there also, date of birth. First preference to date of birth, then only age. Remember that. Now fifth one is the body. This is the main course. Till now these are the desserts. Desserts means when you go for a dinner, you'll go for a dessert first. So number 1, number 2, number 3, number 4. These are the desserts. And this is the main course. And these are the sweet dish at the ending. Sorry. Starters and desserts. These are the starters, the recipient's address, the date, the salutation, and these are the starters. And this is the main course. And these are the desserts, finally. And the closure. And then the last one is the sender's particulars. The sender's particulars. Okay, the main body is in 5 paragraphs. The main body will be in 5 paragraphs. The first one will be the introduction. The first one will be the introduction. This is a discharge letter. Remember, this is a discharge letter. You should know that it's a discharge letter. So discharge plan. Okay. So you are writing a discharge letter. Doctors, you are writing a letter of discharge. Okay. Now here, nurses, communicating discharge instructions. So this is a discharge letter. Should understand that this is a discharge letter. So I am teaching only discharge letter instruction now. Okay, discharge letter only I am telling you. Right. Tomorrow morning I'll teach you referral letter. Tomorrow evening I'll teach you transfer letter. So this is a discharge letter. So in the discharge letter, you're writing here. First one is the introduction. You're writing the introduction. So in the last, okay, B, this is B, then C, then D, then the conclusion. So now these are the remaining. This is the head, this is the header, and this is the footer. Head means the most important points will come here. And the same thing will come here in a different angle. The same thing will come here in a different angle. Yes. Right. So now here in fourth one, this will be the discharge plan. Post discharge. Post discharge. And this is upon admission. Okay. This is upon admission. And this is during hospitalization. So simple as that. This is called organization of the letter. First one is upon admission. So you will start all these things with this only. Upon admission, during hospitalization, and following the discharge. So these are the 5 paragraphs which you are going to write. So first, introduction, then admission. So an admission, what happened? Why was she admitted? What happened? Everything. Then after admission till discharge will be the next paragraph. Then after discharge, what you have? So this is the past. This is the past. It will always be in the past tense. It will always be in the past tense. Admission will always be in the past tense. Okay? Because admission finished. Hospitalization is going on, not discharged. So this will always be in the present tense. This will always be in the present tense. Because it is going on. Admission, how was the condition? How was the condition upon admission? Why was he admitted? When was he admitted? All these things finished. This is a finished story. Admission is done, finished. Discharge is yet to be done. This is a past tense because this is a finished story. You should know what it is going on. This is the ongoing story. This is the ongoing story. And this is future tense. It will be in the future tense. And remember, sometimes we write in the present also, but present tense, okay, in the simple present tense is nothing but is overall past, present, and future. Is recommended means past, present, and future. So it is involved in future. Simple present tense. Are suggested, are advised, is. So simple present tense. I advise you. Advise you for what? Tomorrow. I recommend you for what? For tomorrow. For day after tomorrow. I inform you. I suggest you for tomorrow, not yesterday, not for yesterday. I suggest you means always. Always means present, past, future. So it is taking future automatically. This is the course of action story. The COA, course of action story to be taken. Yeah. So these are the 5 different things you have to follow. Yeah. So now you can clearly see here. So the past, the present, and the future. Everything is unfolding now. Everything is unfolding. Okay. So before admission, till admission is one. After admission to discharge is another one. After discharge is another one. So this is how you are trifurcating the main body of the letter. So this is the way how you have to divide in a discharge letter. In a discharge letter. This is how you are going to. So past, present, and future. Past, present, and future. Yeah. So if you can analyze these points, that is as simple as that. Any doubts? Any doubts? Hit the button fast. So we are moving forward. If you have any doubts, you can ask now itself, because once we move forward, we are not coming back. Don't miss these sessions for 2 days. Because there are some students who just paid for 5,000 rupees for only 3 days. 2 students are there now. Okay. So they did not have time. We have a lot of time, but they don't have time. So I'm giving them. So by the way, we can enjoy. Yeah, thank you very much for the response, because that is what gives me motivation to move forward. Right. So having done that one, we are moving forward to the body of the letter. So we are going to write sentences now. How are we going to trifurcate this one? Now let us see in the case notes. You see in the case notes, this is discharge plan. So this will go into the 4th paragraph. 4th paragraph. This will go into the 4th paragraph. And now assessment, good progress overall. This is medical progress. This is all during hospitalization, nursing management. Okay. All these during hospitalization. Okay. Mobility, post-operative. So all these things. Okay. During hospitalization, post-operative. Then next one, post-operative care. Then next one here, medical background. Okay, medical background, because this is the reason why she was admitted, all these things. Okay, what medication was given, okay, earlier, before, background. You can understand background means past tense. So it will go into the 2nd paragraph or main body paragraph 1. The main body paragraph 1, the main body paragraph 2, main body paragraph 3 are past, present, and future. Okay, if it is an urgent letter, even in discharge, if it is an urgent letter, okay, it will become a referral letter or transfer letter. It will not become a discharge letter. You are referring to somebody else again. Urgent. Urgent means emergency. You are going to another hospital. So it will no more be a discharge letter. It will be an urgent letter. So now let us see here. This is social background. This is also first paragraph. Okay. Background, history, past. Social background, past. Okay, whichever is important that will take. Medical history, past. So everything will go into the past. So upon admission, all these things are there. You should remember that. So what is past, what is present, what is future, you should be ready to identify. Now, all of you should be active. Write in your notebook and also write. Once you write in, first you write in your notebook, then type in the chat box. First, I'll take time because you are going to write in the exam. Think like that one. Don't just write something and push it off. I don't like. Avoid the mistakes. If Simon sir says there is no mistake, if Simon sir says there is a mistake, that means you are careless. What you have to do is, so try to see that there are no mistakes. Try to see that there are no mistakes. Mistakes will be happening, no problem. So the more mistakes you can avoid. So first you write in your notebook. Second, then you check it, then correct it, and they send it. Still mistakes are there, there is no problem. You are not careless, you are careful. Directly you send there and there are mistakes, that means you are careless. So what you are supposed to do? Take a notebook, write in the notebook, correct it, fire it, then afterwards type it, then still mistakes are there, that means you are careful. You tried your level best. So you want to be careless or you want to be careful? You think, because you are wise enough. So, because I am making you to brainstorm now. I'm making you to brainstorm now. Yeah, we are starting with the introduction now. Right. Now let us see. In the introduction, what will go? So Mrs. Fletcher, again Mrs. Fletcher, Sally Fletcher, no, Mrs. Fletcher is enough because we have already written there. Mrs. Sally Fletcher. Okay. Now, diagnosed with endometriosis. So I'm going to give you the points. First one is Sally Fletcher. This is the first point. In the introduction, so the introduction 1.1, sorry, 5.1. 5 is introduction and 0.1. 5.1. This is introduction. Introduction. In the introduction, there are 3 things which you have to write. Okay, fine. First one is patient. Second one is the background. Third one is the purpose. The patient, the background, the purpose. These are the things which you have to notice. The patient, yeah. Yes, the patient, the background, the purpose. Now, how are you going to do these things? And other than that, okay, the setting. So is this the type of letter? The letter type. Is a discharge letter or whatever it is. The next one is when discharged or when or transferred when. or when is he going there? The next one is where is he going? When is he going or where is he going? So these are some points. Now I'm going to show you the same thing here. The first one is, okay, first one is Mrs. Fletcher. Mrs. Fletcher. And the background is, okay, the background is diagnosis. Diagnosis. And the background is diagnosis. And what is the reason? Purpose. Purpose. What do you want them to do? So diagnosed with what? Diagnosed with what? So background, and the next one is diagnosed with what? Okay. And what is endometriosis? So diagnosed with endometriosis. Now, the purpose. What is the purpose? Okay. What is the purpose here? So the type of letter is a discharge letter. And the purpose is, go there and check here. What is the purpose? Purpose is, okay, discharge plan, this what you are going to do. But what is expecting, what she is expecting here is, yeah. So discharge instructions to the home health nurse. Write a letter summarizing the patient's condition and communicating discharge instructions to the home health nurse. So now you can check out here. So now, what are the discharge instructions here? So patients should be discharged when she can eat, ambulate, and urinate independently. And this is discharge plan. When should be discharged? But this is not included everything. So you can see here, all these things are required. What are required, you have to see. So everything you can see. Driving is prohibited. Okay. And it can be resumed after 24 to 48 hours after his final dose of analgesics. Okay. Sexual activity can be resumed 2 weeks post-operatively. So this one, 2 weeks. Okay. And encouraging oral fluids. Ambulation accordingly. Right. So what are the things that are required? You can see here. Showering is permitted from the very next day. So here, laparoscopic surgery considered and done on the 25th of March. 25th of March. Appointment 25th of March. Surgery also same day, and same day discharged. And she can shower the next day. So this also going into post-operative care. There is nothing during hospitalization here. Try to see what is important. Okay. So post-operative care is left to that home care nurse. Patient can ambulate if confident. Same day, no. So you can see where it is going. These are all going into post-operative. That means after discharge, this should be done. Okay, 24 to 48 hours. Today she is discharged. But driving can be done only after 2 more days. No, after final dose of analgesics. Analgesics till when should be completed? Then only. So 2 weeks means a fortnight afterwards. So try to understand these things. Many students have written. Okay. So now we are going to have the introduction. So I gave you already here. So it is, she requires all these things. So care should be taken and management should be provided. Follow-up action. So you can say two things are required here: ongoing care and appropriate management. Ongoing care and appropriate management. Yeah, ongoing care and appropriate management. The next one, it's a discharge letter. When a discharge? Today. Discharge today itself. Where? Back home, because home health nurse is going. So she is discharged back home. Okay. She is discharged back home. So this is the way how you have to follow it up. So Mrs. Fletcher, who was diagnosed with endometriosis, requires ongoing care and appropriate management following the discharge back home today. Okay. So this is the way how you are going to write. So there you go. Come on, write your introduction. For example, if I write, it will be just like this: Mrs. Fletcher, comma. Don't write I am writing to discharge, I am writing to transfer, I am writing to. There is no, it's nothing but nonsense. There should be some speciality. If you are telling I am writing to refer, I am writing to transfer, I am writing to update, I am writing to refer, I'll tell you only one thing. You say I am writing to refer, the same thing I am going to show you now. I am writing to refer. So if you say like this, now the sentence is, first you are talking I is the subject, is equal to I. Now I is doing the action. So who is writing? You are writing. So the nurse, the person who is writing. But what I am saying is I am writing to refer XYZ. Now what you have to do is you bring XYZ here first. XYZ is being referred. Blah, blah, blah. Now what is the difference between this one and this one is from heaven to hell. This is hell and heaven, or sky and ground. You are on the ground level. Basic English, this is. Basic English. That means you can never fly. So this is extraordinary English. This is just ordinary. Basic means ordinary. So these are ordinary people who are writing like this, and that is the reason why they are not passing the OET. And if they are writing correctly, at least they will pass. There are some lucky few who don't do mistakes, then definitely they will pass. But you do this active voice and again do mistakes, definitely you are prone to. Now let me tell you one thing. Here the person who is receiving the action, that means XYZ. Abraham Lincoln is being referred for. I am writing to refer Abraham Lincoln. So there are two problems, not just two problems. There are three problems here. There are three problems in this one. In this basic style, there are three problems. First one is you are using active voice. Number one, flaw number one, you are using active voice. Flaw number two, you are using personal pronouns. Flaw number three, you are using redundant words. In these five words itself, you are using three different flaws. Active voice, I am writing. So you are talking about yourself. You are not talking about the patient. You are talking about yourself. I am writing. Yeah, you are writing about yourself. Who wants you telling about yourself? Who wants it? Who wants it? I lost my purse. You found my purse and brought it to me. I found your purse. Whether you find or somebody else finds, it doesn't matter. I get the purse is important. My purse is found. That's all. When you are at school, when the school bell rings, you will not wait. The peon rang the bell, or the teacher rang the bell, or another student rang the bell. Who rang the bell? Nobody will bother about it. That's a nonsense for everyone. Nobody tells you only the peon rings the bell, you should go. No. The ringing of the bell is important. Who rings the bell is nonsense for us. So you should understand what is the difference between ordinary level and extraordinary level. Many times I tell many students, they don't even mind, they don't even bother. They say it is difficult for us. Yeah, everything is difficult. Was it easy to become a nurse or a doctor? How could you become a doctor so easily? If you can become a doctor, if you can become a nurse, why can't you write sentences? So think that this is life and death. That was your life and death. You wanted to be, that was your dream, that was your ambition, that was your goal, that was your target, and you cherished it. Then why not this? Right. So these are the three fatal flaws. This is not mistake. This is not wrong. But you know, tomatoes in the street market and tomatoes in the supermarket, you will not find even one bit of dust on the tomato. You will not find even one wrinkle on the tomato. You will not find even one black spot on the tomato. Why? Because care was taken to present it. That's why you are paying the price a little higher than what you get in the street market. In the street market, you get tomatoes for $1, but you go to supermarket, it will be $1.5. That's the difference. They will be categorized according to the sizes also. So be careful. So if you follow the same style, then you will get better marks. So ordinary English will give you ordinary marks, and extraordinary English will give you extraordinary marks. Now the same sentence, X is being referred. So I am talking about the patient. I am not talking about myself. Then second one, I is missing here in the second one. And there is no active voice, it's passive voice. So try to understand, we are overcoming these three fatal flaws. Active voice, not there. Personal pronouns, not there. Redundant words, I am writing to refer. Why? Anybody will write only. Will you sing a letter? Will you dance a letter? Will you cook a letter or will you fry a letter? Writing is a redundant. Letter is for it to be written only. Or you will type a letter. It will be either written or you will type. But without telling, they will know that you have handwritten or typed also, they can understand. Nah? The paper is in front of them or the computer is in front of them. If you see in the computer, that is typed. If you see in the newspaper, it is written. So why do you want to say that I am writing, I am typing? Is it nonsense out of common sense? Don't you understand that it is not necessary? People can understand, but still you are writing. Means what? You are walking on the road and you are telling I am walking on the road. Huh? You are wearing a shirt and you are telling I am wearing a shirt. Can't people see? Why do you need to tell others? So that is called redundancy factor. Now what is redundancy? I don't know whether many of you know it or not. Redundancy. It's not an ordinary word. Not every Tom, Dick and Harry can understand this word. Redundant. Because it is beyond ordinary English. Redundant. Redundant is C2 vocabulary. Do you know what is C2 vocabulary? I told you C2 vocabulary. Redundant means especially of a word or phrase unnecessary because it is more than is needed. Then why are you using it? When people see your letter, can't they understand that you have written it? Then why are you wasting on one word writing unnecessarily? What is the use of this word when people can understand? What is the use of this word? Why did you write this word? Can people understand that? So quality is more important. People who do not know how to write, they write all these things. It is called cheap quality. That's it. If you work hard, you will get better quality. So try to gain that quality. So avoid these three things. Active voice. Now you are telling me, sir, many people are writing. Many people are writing. Yeah, many people are writing. You want to be in the same well. Go and be in the frogs in the well type of category. Frogs in the well. What do you mean by frogs in the well type of people? Because they don't know. They are ignorant. Frogs in the well. Frogs in the well. Okay. So frogs in the well type of mental. This is Indian quotation. Frogs in the well. That means people who live in a closed space. They don't know about the real thing. They will be in the false imagination that what they are doing is right. But they don't even realize that they are doing wrong and there is nobody who is going to tell them. And if somebody like me tells them, they will not even bother. Because everyone is writing like that, sir. But I'm not telling you to do like this. I'm not telling. Cambridge Dictionary, sorry, OET is telling you to do that one. OET is telling you to do that one. What is the OET telling you? Active or passive in OET writing. Just to click that one. Passive voice can be used in OET letters as it is good practice. Good practice. That means using active voice is not a good practice then. Okay, this is from Benchmark. So we don't want Benchmark. Why should we follow? Benchmark is another group of organization like Simon Peter. Why should we trust Simon Peter? Go to occupational English test. Occupational English test. So here, occupational English test is asking three different things. Do you know how to write passive forms correctly? Occupational English telling, do you know how to write passive forms correctly? This shows that, do you know what is active voice and passive voice? Do you know how to write passive voice? Do you know how to write passive voice correctly? First thing is you should know what is active voice and passive voice. Second thing is you should know how to write active voice and passive voice. Then you should know how to write correctly the passive voice. So OET is asking, do you know how to write passive voice forms correctly? That means you should know how to write passive forms correctly. So you should know passive voice. You should know how to write passive forms. You should know that passive forms are important. You should know that you have to write the passive forms correctly. Forget about passive forms correctly. You're not even writing passive forms. You don't even know passive forms are existing. You don't even know it is the demand of OET. Oh, this is not Simon sir. OET is not Simon sir. Simon sir is a very ordinary teacher. Okay. So you are supposed to write. Why? Passive forms are great. Passive forms are great. That means active forms are weak. Don't you understand? If you say Simon is tall and Simon and Peter both are there side by side, if Simon is tall, automatically Peter is short. That is very clear. If you say Simon is strong, that means Peter is weak. You should understand that. It is implied. Passive forms are great. That means active forms are not great. They are ordinary. Passive forms are extraordinary. That's why they are great. And active forms are ordinary. They are not great. Because when you say active forms, you are telling about yourself. You are telling about the doctor. You are telling about somebody else who is doing the action. That's not important. So make the patient important. Make the treatment important. Make it the focus of the sentence. Bring it forward and make it the subject of the sentence. Using it during writing and speaking subtext can help your language be more sympathetic. That means it will be proud. If you say, I will explain you how to take insulin injection. I will, don't worry, I am there to help you. Oh, wow. Only you are the only person in the world who is going to help you. What nonsense are you talking? You should realize that you are not the only person. Any nurse in the world can do what you are going to do. Then what is your greatness? Then why are you bringing I into the picture? Huh? Are you the president of America or the prime minister of India? I, so much great. There is no need. Patient is important. Give him importance. Your gesture, service, that's all. If not you, somebody else. Then what is your greatness? If you are saying, I will explain it, that means you are proud. You are arrogant. You are rude. You are not kind to the patient. OED is telling very softly, but I am telling you harshly. Be more sympathetic. If you are not sympathetic, that means you are rude. You are proud. Okay? Be sympathetic. That's the point. So the way how you are writing will prove what type of words you are using. The next one. As a nurse, you can use language to build better relationship with patients. So instead of pitting the performer of the action first, the passive voice makes the person or thing being acted the subject of the sentence. So bring it forward. That is what we are doing. That is what we are doing. Yeah. So many people are writing. Very good. So now I want to ask you one thing. I told you to write in your notebook. I'll be speaking what all I want to speak. I'll be speaking. No problem. You carry on with your work. They're very important things. I'm telling you. So here, so you can write the 3 different things, 7 different stages. So one more point which we were missing is, so diagnosed. So who was admitted to the hospital for endometriosis? Okay, for the surgery, or you can say diagnosed with. So there are 7 categories: signs and symptoms. Okay, preliminary diagnosis, that is. Then definitive diagnosis, that is diagnosis. Then admission stage. Then recuperation, surgery stage. Then recuperation stage. Then discharge stage. So here you can use diagnosis. Now he is recuperating also, you can use whatever you want to do, however it is, whatever the latest stage, that try to use it. So this is the introduction. I think you got it very clearly. Clarity, CCC. That is called concept check questions. I'm going to ask you now. So 0. Now grade the explanation. Read the explanation. 0 to 10 scale. If you understood everything, then you give 10 points. If you did not understand anything, give 0 points. You are right. You have right to give 0 to 10, anything, whatever you want to this introduction part. I just want to know, because I want to know whether you understood or not. I know what I am doing. There is no doubt regarding it. I don't want any favor from you. I want to know whether you have understood or not. If you have not understood, let me know what you have not understood so that I may still further. Let me get some water, please. This is the reason why students are getting 400, 450. Those who are not serious, I don't mind. I'm doing my duty and nobody can point a finger at me. Right. The next one. Yeah. Now I'm giving you, say 3 minutes. Write 3 or 4 different types of introduction. Whatever you want. Okay. Write with admitted. Write with who underwent surgery, or who are recuperating following the surgery, or okay, whatever you want. Write your own sentences. These are the points which you have. Mrs. Fletcher, who was diagnosed with endometriosis, requires ongoing care and appropriate management following the discharge back home today. Finished. So simple, one sentence. Write your own sentence, introduction. Those who did not write, write. Those who have already written, write something else. Try, no problem. 3 minutes I'm giving. I'm preparing some coffee. I'm very happy today. I told you, we got the agreement done, and pray for the institute, because this institute is going to show some, okay, difference. If offline I'm doing, online I'm doing so much, means in the offline, how much it will be? And if you know any teachers who have completed masters and in English and masters in education, you can recommend them to me. If anybody is there in Trivandrum, I'm going to train them. I'm a teacher trainer. In a B.Ed college, I made number of teachers. I can train them well for you people. So all of you write your sentences. Hina Salim. You cannot say who is recovering. You can say who has been recovering. Is recovering means just now. Okay, since morning, now, and evening also. You cannot say is recovering means at the moment. Present continuous tense means now. Now recovering. That means after half an hour he will not recover. Before half an hour he is not recovering. That's the meaning indirectly. Has been recovering. It's a long process. Maybe it will take 2 days, 3 days, 4 days, maybe 15 days. That's what, after 15 days only he can participate in sexual activity. After 24 hours after what's that? medication, then only she can do the driving. So how can you say is recovering? Is recovering means only now. I am teaching. Mr. Peter is teaching means now it is going on. If you want to say now, then it is that one. The word now is there, then only is recovering, is teaching. I am sitting. That means after 10 minutes, I will not sit. Before 10 minutes, I was not sitting like that. I have been teaching means for last 1 hour, 2 hours like that. Wahi the metlo, spelling mistake, Fletcher, spelling mistake. Be careful, check. That's what I'm saying, check. Yeah. Right. Mrs. Fletcher, who has undergone endometriosis, is being referred into your facility for ongoing care and appropriate management. Okay, who has undergone? Okay, that is present perfect because it is the same day. You can write has undergone, or if it is 1 day before, okay, then you can say underwent. Same day, both are okay. Underwent also you can say. It means in the morning. Yeah. So that is how introduction will go. Next. So OED is asking you to use passive voice, okay? And write passive voice correctly. Learn it is telling. If you don't know, learn. That is the meaning indirectly. This is the soft way of telling. Okay. Why it is telling is because of these 3 points which I have told you now. If surgery is given, we have to give priority, or that we can write diagnosis also first. No, you can write surgery. Whichever you feel priority, you write. Latest one. Who underwent surgery after admission? No? First diagnosis, then admission, then surgery, then recovery. So which is the latest? That one you can write. Now here recuperating is the latest one. Who has been recuperating following the surgery or something like that. Whichever you, all are correct. No problem. No problem at all. No problem at all. However you feel comfortable, you can write. There are 100 different ways of writing. You can write no problem at all. Yeah. First, second. Yeah. Can you type your name first, second? Yeah. Let me touch our regular students. Okay, new students, whether they have understood. Suma Maria, is that clear for you? Suma Maria. Yeah, 2 or 3 new students I will ask. Suma Maria. 1 second. Yeah, Suma Maria, is that clear? From bottom, from Z I am going there. Up. Suma Maria, okay. Shifali Prakash, is that clear?
Yes, sir. My doubt is clear regarding the surgery or the diagnosis.
Yes, fine. Ranjit Kaur. Ranjit Kaur.
Hello?
Yeah, Ranjit Kaur, is that
Hello.
clear for you?
Yes, sir. It's clear.
Any doubts are there?
No, sir.
Okay, fine. Then who else is there? Okay, all are only 2. Where is that another girl? Shanawaz, Safia. Hello, Dr. Safia, is that clear?
Sir, just I joined because it was some problem in my
Okay,
mobile.
no problem.
So,
No problem. I put it on the YouTube also. Afterwards, you can see. Okay.
Okay, sir. I will check.
Then where is this doctor? New doctor. I think he's on duty. Okay. And otherwise, everyone is right. Manjula Ravikumar. Hello, Manjula.
Hello, sir.
Yeah, is that clear to you?
Yes, sir. It's clear to me, sir.
No doubts, right?
No, sir. No, sir.
These 2 days are hectic days. So go on attending all these sessions. Tomorrow morning, I'll be explaining referral letter
All right, sir. I'll
and the
attend.
transfer letter tomorrow evening. Okay. So
Thank
going to discharge, no, going to be discharged, passive voice. Okay. Why going to unnecessary again? Will be discharged. Simple, no, be simple. Okay, next. Next one is, now we are going to write sentences. I'll give you the points. I'll give you the points. Yeah. Introduction is over. Now, so you have already set up endometrial cyst and other things. Now you can use some words, okay? So painful periods are 3 years. Painful periods, 3 years. So I want you to write, for every sentence, I'll give you 1 minute. So these are the 2 words. Now I want you to write 1 sentence using painful periods for 3 years. Yeah. First write active voice, then write passive voice. First write in your notebook. If you do mistakes, no problem. First write active voice, then change it into passive voice. There are steps, no? If mistakes are there, then I'll come. First you write active voice, everyone. Start with she. Okay? Start with she. Do you want to see in a OET, official OET also, there are some mistakes. It doesn't mean that, see this book also, there are some mistakes. It doesn't mean that 100% everyone will be right. There will be devil's mistakes also. Sophia, menses spelling. MENSES, SIS. Okay. So Cambridge Dictionary. MENSIS. Okay. So this is the word. You made a mistake. How can you make that mistake, doctor? So you cannot. You have to be very careful. Okay, like these 3 mistakes and you lose 1 mark, 10 marks. Okay, no problem. We do mistakes. We have to improve. Okay, this is formal. Okay, formal. So menses, formal. Write down this one. Menses as formal word. An occasion when a woman menstruates. So that's it. This is also formal. Okay, when a woman menstruates. Yeah, this is it. So instead of suffering, you can say experienced painful periods. Why do you want to use the word suffering? Experiencing. What's the difference between suffering and experiencing? Let us see there. Suffering and experiencing. What is the difference between these two words? Suffer. Suffer is B1. Experience is also B1. Okay, but the word is high level. Suffer is negative, experience is positive. Okay, suffer is a negative word. Suffer is a negative word. So feel pain. To experience physical or mental pain. So to experience painful periods. Finished. Painful periods for the last 3 years have been reported. Finished. Why do you want to use a she? Painful periods for the last 3 years have been reported. Okay. Now, next sentence. Next sentence. And this is because of what? This is because of this one. So add this one to this one. Now these two. Make it a bigger sentence now. Because of, due to, caused by. Now so she was suffering from endometriosis. She had an endometrial cyst. Okay. Endometrial tissue, endometrial cyst. Okay, whatever it is. So now these two things, add with these two things and send them. Now, write your sentence. Painful periods were experienced, Jessica. Shifali Prakash. She has been experiencing painful menses since past 3 years. Since 2020, you have to say. Otherwise, for the past 3 years, you can say, not since. Since used starting point. Okay. Since is used for the starting point. So you can use like this. Since, okay, since 2000, that's it. Or you can say for the last 3 years. So these are the ways how you can write. So write down this structure. Write down this structure, all of you. You can write since 2000, means starting time. Since 2000 means starting point you have to use. When it started. And this is period of time. Period of time. And this is starting point of time. So write this in your notebook. Rule number 1 and rule number 2. 2 rules I have told. Shifali Prakash, because of your mistake, I have told you this. Okay. So I don't know whether I can take your names and tell. No problem. Okay, you are students. So is that clear, Shifali Prakash? You did a mistake and I have given you 2 points. Is that clear for you? Yeah. Did you understand what I have corrected here in your sentence? Okay. Your voice is not able to be heard. Okay.
Yes, sir.
So-
Yeah, hello, sir. Hello, sir.
You
Yes, I have
understood
put it, sir. Yes, sir.
You understood the points, what I told you?
Yes, sir.
So I have been learning English since 2005, or I have been learning English for the last 18 years, like that. Since
Yes, sir.
starting point. Okay, since day before yesterday, or for the last 2 days, like that.
Yes, sir.
All of you write these structures, two structures. Number one is period, point of time. Number two is period of time. These are the two concepts. Yeah, write down your sentences, please, all of you. Next one is yeah. Now next. So next, take this sentence. So make a sentence. So pain persists despite taking OTC. Now despite. Now you can use this sentence in many different ways. In spite of, despite, though, although, even though, but, yet. However, many ways of writing this one. You can use any way. Instead of despite, you can say in spite of, though, although, even though, but, yet. Over-the-counter medication has been taken, but persistence of pain has been noticed. So good participation is seen. 7 people have written. Very good, very good. Next point is next point. Next point is here. Patient recovering post-operatively from laparoscopic surgery. This is the point. And no complications. So you can take any one of these things. Okay, this one. This is the point now. So this, make a sentence using this one. Patient recovering post-operative. from laparoscopic surgery. Post-operative recovery has been uncomplicated, unremarkable. So start with post-operative recovery. Patient is recovering. That means she is recovering. That means post-operative recovery. Recovering, you have to change it to recovery, noun form. Post-operative recovery. Recovering post-operatively. So post-operative recovery has been unremarkable, has been uncomplicated. Write down whatever you want to write down. Very good. People are writing faster. Hina Salim, post-operatively is one word. Meera Manoj, excellent post-operative recovery has been observed. Very good. Post-operatively, she made good progress. Why do you want to write a she? Hina Salim, you can say no. Post-operatively, good progress has been observed, noticed. Despite taking naproxen, persistence of pain was reported. Very good, Jessica. Although she is Albina, although she is using OET, see, but when you are using although, no need but, use either although or but, anyone, both are, you cannot put two knives into one sheath. Any one you can use. Constance, post-operative recovery, post-operative recovery, not post-operatively recover. Post-operatively, comma, the recovery has been noticed. You can say. Yeah. Now, next one you can say, patient can ambulate if confident. Patient can ambulate if confident. Patient can ambulate if confident. So try to think of the sentences and write. Don't just write like that. Think how well you can write. Your sentence should be the best, not even the second best. It should be the best. Like that, you have to think and write. Next. Driving is prohibited when on analgesics. Driving is prohibited when on analgesics. Mobilization would be depend on her endurance. Mobilization depending on her endurance, not would be. Meera Manoj, mobilization depending on her endurance has been suggested. Mobilization can be considered if confident. Mobilization can be considered if confident. Refraining for driving or avoiding driving, or driving is prohibited. He should avoid driving. Driving should be avoided, Rehana. Yes. Now next point is keep incisions clean and dry. The incision site, keep incisions clean and dry. Who will write the best sentence? I am going to see. Keep incisions clean and dry. Incision site, only one. So the incision site should be kept clean and dry. That's fine. Yeah. So for the month of January, the doctors' admissions are closed. 2 doctors joined. One is Dr. Safia and one is Dr. Noor. Admissions are closed for doctors for the month of January. Nurses, we have 2 places still. Incision site must be clean and dry. Keeping the incision site is advised, suggested. So next. Sexual activity can be resumed 2 weeks post-op. Next sentence. Keeping the incision site clean and dry is mandatory. Good sentence. Incision site was performed clean and dry. Suma, does it sound fine? Improve on that sentence. Okay. Sexual activity can be resumed 2 weeks post-operatively. That's the next point. This will go into the last paragraph. It is encouraged. Noor. Instead of it is encouraged, remove it is encouraged. Sexual activity, avoiding sexual activity or refraining from sexual activity for a fortnight post-operatively is encouraged. Remove it. No, it is a pronoun. It is a pronoun. Sexual activity resumed after 2 weeks. Resumption of sexual activity after 2 weeks is recommended. Resumption, resume, very good word. Resume, what type of word is it? Let us see. Resume. Resume is C1. And how to make this C1 as C2? I'm going to show you now. Resume is C1. Resumption. Now what is this level? The start of something. Resumption. Resume, resumption. The next point is encourage oral fluids. Encourage oral fluids. Oral fluids are encouraged. Consumption of excessive oral fluids is encouraged. Consumption of excessive oral fluids is encouraged, is suggested. Now what you have to do is, you have to change the word. Encourage is there, so suggested you can say. That means use some different word, that's the point. And don't copy the same words which are there in the text. Okay. Whatever. Yeah. Next point is here. Showering is permitted 26/3/2018. Okay. Showering is permitted 26/3/2018. That means tomorrow. Today is 25, so tomorrow. It's the same thing for doctors also. Now the word refrain, the power of the word refrain. What is the word refrain? R-E-F-R-A-I-N, refrain. Refrain is C2 vocabulary. Refrain is C2 vocabulary. Very good, very nice. Everyone is participating. Everyone is participating. Wonderful. Person, place, 4 P's, orientation, person, place, time and situation. Orientation regarding person, place, time and situation has been excellent. Well oriented, so excellent. Then patient may return to regular diet. Next sentence. Patient may return to regular diet. Patient may return to regular diet. Yeah. Now, the last phase. Now you have written sentences. Now I am going to show you. So many people are writing patient, patient, she. See, that's the mistake. Now, that's sentence is correct, but OET standards is low. So according to OET, it is wrong. It's not very fine. That's why you will get less marks. So now let me give you some sentences. Yeah, how many of you are going to be dynamic for the next 30 minutes? Dynamic. Okay, so dynamic for the next 30 minutes. I'm going to give you sentences in active voice. You are going to write in passive voice. Okay. Right. Those who are ready, yes, you can type your name, first name and second name. Those who are ready, can type your first and second name first. Because I'm going to give you wonderful sentences. And I'm going to give you practice for active voice and passive voice. First I'll give the sentence, then I'll give you time for writing, then I'll change it into passive voice. And passive voice 1 and passive voice 2. Second passive voice is important. Yeah. Getting ready. She is now ready for discharge. Now this sentence, now can you make it into passive voice? I love passive voice. Okay, doctor, no problem. It is there on the YouTube, no problem. She is now ready for a discharge. I'll be happy if anybody can. She is now ready for a discharge. I will be very happy if anybody can give a wonderful sentence for this. Yeah. Come on, ready? Discharge is being ready for now. Sorry, it's wrong. Ready for a discharge now? No. She is being discharged. That's okay. Same thing like that. She is being discharged today. Write capital letter, write full stop. Sentence should be like that. See how I am doing? Capital letter and full stop. She is getting discharged today. Okay. Everyone is habited with she. Nobody is writing without she. Shifali wrote, but it's not making meaning. Yeah, come on, come on. Her discharge has been scheduled for today. Almost 80% good. Discharge is being given to her today. No. Discharge has been ready for her. No. Right. So what is the most important word in this one? Tell me. Come on, type. The most important word. What is the most important word? One word. So discharge today. No, one word only I want. Ready. Okay. What about the others? All of you type the word which is the most important word. She is now ready for discharge. Which is the most important word? Yes. Discharge is the most important word. So just start with the discharge. Discharge has been scheduled. Finish. Discharge has been scheduled. Finished. So write in a different style. Discharge has been scheduled. That's it. So you can use this sentence in your exam, okay, or while you're speaking. Even in your daily routine also you can prepare like that. Now the second sentence. This is sentence number 1. This is sentence number 1. Okay. Sentence number 1. Now sentence number 1. She underwent laparoscopic surgery. Sorry. She underwent laparoscopic surgery. Yes, come on. Naveen Hirane, spelling mistake. Performed. Like this only mistakes happen in the exam also. You have to be careful. Yeah. Has been means present. This is past tense. She underwent. Was performed. That's all. Very good. Simple past tense. So change it into simple past tense. Laparoscopy surgery was performed. Okay. Right. Laparoscopy, L capital letter albina, performed full stop. Okay. Yeah. She has been suffering from, she has been suffering from painful periods over the past 3 years. So now try to change this one. She has been suffering from painful periods. She has been suffering from painful periods over the past 3 years. I don't want she. I don't want she. And I don't want the word suffer, negative word. For the last 3 years, painful menstruation has been experienced. Painful menstruation has been experienced or has been reported. Painful period has been reported, or painful period, only one period, no, painful periods have been reported. It's plural. It's plural. Zahra Rahim, battling is a is something like exaggerating. Don't use such archaic words. It is not a battle, so you cannot use the word battling. She's suffering. It's negative. Battle means it's a heroic. Okay, so such words don't use. Period was painful. No, periods were painful. Since 3 years, no. Since 2020, you can say. Point of time. That is what I told you. Just now I told you, forgot. For the last 3 years, F capital letter, Suma Maria. Means 3 years. For the last 3 years, comma, menstrual periods were painful. Have been painful for the last 3 years. Present perfect continuous tense. Have been, yeah. Experienced. Okay. Next one, fourth one. Fourth one. Okay. The surgery removed a 6-centimeter cyst. Okay. The surgery removed a 6-centimeter cyst from the abdomen without any, I'm giving big sentences now, complications. The surgery successfully removed a 6-centimeter cyst from the abdomen without any complications. So here, let me tell you one thing. There are many different things. Arjinder, I was searching for you. You came back. Very good. Yeah. The surgery successfully removed a 6-centimeter cyst from the abdomen without any complications. So from this is, we will not change anything. From the abdomen without any complications also, you will not change anything. So where you will change, the surgery successfully removed a 6-centimeter cyst. So remove, successfully removed. This is the verb. I'm going to teach you now. This is the verb. And this is the actor. And this is the object. So now what you have to do is this you have to bring forward. A 6 centimeter cyst was successfully removed from the abdomen without any complications. The surgery is not needed. Who is doing the action or what is doing the action is not necessary. A 6 centimeter cyst was successfully removed from the abdomen without any complications. The other areas, there are no problem. So, I played football. Football was played. That's it. Six centimeter cyst is wrong. A 6 centimeter cyst, Constance. A cyst. One cyst, no? Cyst is singular plural. A cyst. So, like this, take some sentences and change them into passive. The she should not be there. That's all. She has been suffering from painful periods over the past 3 years. During the past 3 years, painful periods were experienced. Finished. Have been experienced. So this third part, after the verb, what is there should come forward. That's it. So, right. So let us call it a day. So how was the session? How was the session? So give your feedback, please. So when I call you, you can open your mic and you can speak. So tomorrow morning I'll be explaining referral letter. So yeah, Binsi Mall. Binsi Mall.
Good evening, sir.
Good evening, Binsi Mall. Yeah, share your experience.
Sir, from your class, I have learned how to write passive voice sentences. Because whenever I am writing or while I am speaking, I am not getting this passive voice. So that was an eye-opening for me.
Yeah, okay. Next, Albina. Albina.
Good evening, sir. Today I learned how to modify the sentence,
Okay.
especially.
Constance.
Yeah, sure.
Yeah. Very good. Yes, Constance. What did you learn today?
Good evening, sir.
Yeah, good evening.
Yes. Today, I learned how to write a good introduction. The way you actually tabulated how we should put our introduction. I think that was actually an eye-opening to me that when I go into the exam, if I go with that format, especially for the discharge letter, I think I will score high.
Yeah, very good. Fahim Mufti. Fahim Mufti. Jessica Nguni. Mona Abdul Fattah. Jessica.
Good evening, sir.
Good evening.
Good evening, sir.
Yeah, good evening. Good evening. Share your
Yes, today Yes. Today I learned how to convert active voice into passive. And I also learned to write a good introduction, putting the center on a patient, not on a nurse or a doctor. Thank you so much.
You're welcome. Yeah, Constance. Okay. Pranita. Pranita. Rehana.
Hi, sir.
Yeah,
Good
Pranita.
evening. Good evening, sir. How are you, sir?
I'm fine, Pranita.
Very nice session, sir. Actually, I don't know these things. So many things I learned today, sir. Very nice information. Even though now also I don't know perfect sentence formation, I learned. I'm very thankful, sir. Thank you so much.
Okay. Then Rehana.
Good evening, sir.
Good evening.
Sir, first of all, I would like to say you thanks. I have more doubts before
Yeah.
some technique like how we will make format for letter, how we can convert it a passive sentence, and new words also I learned. Thank you for sharing, give us this knowledge. Thank you, sir.
Yeah. Safia.
Sir,
Safia.
good evening.
Good evening, Safia.
Yes, sir. Today I learned so much because before I was thinking I'm making the sentence now, but I now understand how to change.
Yeah. All of you, you can write this letter and submit me because I have sent the letter along with the document. I have sent that to you. You can write this letter and you can submit me. And next one, Shifali.
Yes, sir.
Yes, Shifali.
So yes, I was having the doubt related to the body paragraph. One thing is this that I'm having facing the problem is that how to eliminate the what to choose and what to eliminate in the letters. And second thing is this how to form the sentences with the information given. So my one point is now a little bit clear. I think if I will do some more practice, I will get clear to this active to passive sentences. So thank you, sir, for giving us information.
Yeah, you write this letter and submit me tomorrow. Okay?
Okay, sir. Yes, sir.
Yeah. Then Suma Maria.
Good evening, sir.
Yeah, good
Sir,
evening, Suma.
today's section, I learned two more vocabularies, and then I prepared this words and everything I wrote in the books. Then new words I learned. Then I learned this passive voice, how to write. Always I am using the subjective I, she always in my letter. Now only I understand this passive voice, the importance. Thank you, sir.
Yeah. So you can write one letter, all of you, and submit me tomorrow. I will be correcting the letters. First priority is the regular students, registered students. If afterwards I have time, I'll correct the others. But all of you can submit the letter and learn. Okay, then that's the end of the day. Thank you very much. Good night, all of you.
Thank you, sir. Good night, sir.
Good night, sir.
Good night, dear.